What does it mean to think you might have cancer, to have cancer, or to live beyond cancer? What does that mean to you individually? What does that mean in people's lives? What does that mean about how we try and continue to live our lives with who we are? And what do we need to do differently that helps support people during any part of that journey? And then we have this incredible place called London. And I absolutely love London. But I also, having worked for a long time in health, know that London doesn't do stuff brilliantly all the time. It does some amazing stuff, but it woefully lets people down at a time that's really important.
What's it like in the last 15 years? What's it going to be like?
Today's event is a mix of Macmillan's own teams who are recognising that the strategy might mean having very different conversations in the future with completely different partners that we had never thought about working with in the past. And then also, more importantly, there are Londoners here who've had an experience of cancer.
One of the biggest and most important parts of the strategy has been talking to people who've had an experience of cancer and live in London, because it's been through that we've been able to really understand when London works for you when you've got an experience of cancer and when it doesn't.
What we're trying to do is say, okay, let's not think about the clinical services, let's not just think about health and social care. Let's think about how London can do different things, build different partnerships.
We've got the ability to contact new community groups, new employees, new corporate partners. I think healthcare providers are open. They recognise that actually they don't have the capacity to continue as they are. So I think now is the opportune time.
An integrated cancer system that embodies diversity, equality and empowerment.
My hope would be that from today some really clear actions and next steps are formulated to actually build a really great strategy that's going to make a real difference for Londoners and the cancer care that they receive. Just thinking about the strategy being really clear, really focused.
I think it's really important to give us focus over the next 10 years. And I think one of the challenges that faces an organisation as big and as ambitious as Macmillan is that it's too easy to try and do everything. So it's really important to get some real focus and clarity about what does Macmillan want to achieve in a massive complex city, and be absolutely specific about that and then put its drive and ambition behind it. That's why it's important to get a general consensus about what we're going to be doing, because it will be a big change for us.
We're challenging each other's assumptions. We're starting with a blank piece of paper because we're leaving all of our preconceived ideas at the door and we're going in and completely thinking differently. So that's really exciting.